So our next panel, I'm going to invite our next panel to actually come up to the stage and have a seat. We're going to have the full panel come up. And Anna Ricklin, who is on the planning committee for this meeting and one of our advisors, is the manager of the American Planning Association's Planning and Community Health Center, where she oversees applied research and place-based initiatives to advance health-oriented planning practice. And she'll be joined by Juard Barnes, who is the Live Free Director for the Indianapolis Congregation Action Network. And in this movement for racial and economic dignity, he leads the work around criminal justice reform and violence reduction. But prior to his position with IndyCAN, which is the name of his organization, and the Live Free movement, Juard served as pastor of the Eagle's Nest. He performed anger management and other forms of training for various nonprofit organizations. We also have Rufus Williams. He's the president and CEO of the BBF Family Services, formerly known as the Better Boys Foundation. He is an active community leader who works to secure opportunities and advancement for children and families. He hosts and co-hosts issues-oriented talk shows on WVON radio. And he is a CPA who began his career at Arthur and Anderson Company before becoming a corporate audit manager at Baxter Healthcare Corporation. It's just interesting. I picked out a few things to read on people's bios that were really kind of disparate and diverse, even within the person themselves. Their backgrounds, education, where they used to work, where they currently work. It just really amazed me. We have Sam Jew, who is a director of the Magnolia Community Initiative, which I had the pleasure to visit, as well as Push Buffalo this summer. He oversees the entire scope of the initiative by engaging directly with MCI partners to realize the strategies and practices that support positive community-level changes. For 26 years, he's worked with low-income immigrant communities in Los Angeles County, managing programs that address child abuse prevention, community engagement, and capacity building, gang prevention, mental health, and substance abuse services, and youth leadership development. I'd like to ask Vesna Kutlesic to come up as well. And Vesna, I think you were in Amman, Jordan with me, right? Oh, you missed that one. Okay, so Vesna also had served, it's not in her bio, but on that global forum with us as we were addressing investments in young children. So I've traveled all over the world with Vesna. She's an amazing colleague, and she's the director of the Office of Global Health at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Dr. Kutlesic was a Fulbright visiting professor in the psychology department at the University of Belgrade in Serbia, while based in the psychiatry department at Case Western Reserve University in Cleveland, Ohio. She also worked as a senior international consultant for UNICEF. Aaron, I'm going to keep this very short because you just saw Aaron on the video, but he is the co-founder of Push United for Sustainable Housing, Push Buffalo, which mobilizes residents to create sustainable neighborhoods with quality affording housing, green jobs, and next generation infrastructure. So I think you saw many of those issues highlighted in the video. Professor Pat Sharkey is joining us online. I'm not sure if we're going to see him here, but he is an associate professor with NYU's Department of Sociology. His research focuses on various issues related to inequality in urban neighborhoods, and one strand of his research seeks to describe and explain the persistence of neighborhood inequality in American cities. And the second strand of his work focuses on the consequences of persistent neighborhood inequality for the life chances of individuals from different racial and ethnic groups across America. So we're really, I see Pat here. I'm not seeing him here yet. Okay. Or maybe we're not supposed to see Pat, I think. Sorry. Sorry. We're not supposed to see Pat. Pat, we're not going to be seeing you, and I think that's so that you can see us or something like that. Or I'm garbling it. I'm not a tech-savvy person. Let's just leave it at that. But we're happy to have Pat with us remotely and this esteemed panel. So Anna, take it away.
Sure. Thank you, Kimber, and I'm really excited to be here today. As Kimber mentioned, I'm from the American Planning Association, and our work focuses on how we can help influence the practice of urban planning to shape the built environment to be more supportive of health. At least that's my mission. And because planning shapes the built environment, and I was really struck this morning by one of the artists, Connie Heller, who said that the world around us is made and designed, it's not inevitable. Everything that we see, decisions have been made about where to put the roads and what the buildings are and how the buildings are shaped and who those buildings serve and what all of the land is used for. And that's what attracted me as a public health advocate to the field of transportation and planning, because of the potential, the vast potential to potentially shift those systems and those power structures, and to call into question what those systems and power structures are that make those decisions about the built environment. So when we're calling those into question, we're thinking about how we live, where we go to school, where we work, where we love. And all of the panelists today, I think, are going to be touching on those issues and how we can influence and change them. This is what everyone has been talking about so far, so we're going to continue that conversation with a focus on criminal justice, children and youth, and housing. And I think what you'll hear is that a lot of it does come down to these neighborhood factors for where we live. So these panels are meant to be a conversation. Each person is going to speak just a couple of minutes about what they're working on as a launch into more of a dialogue about how their work is transforming the communities that they're working in. And hear some very specific examples about how change is happening. So I guess I'm going to pass it on to Reverend Juard Barnes to start it off.
Thank you. I was, first of all, moved this work as a kid. I was born in Elkhart, Indiana, and my mother was from Chicago. So my father was from Elkhart, my mother was from Chicago. I had two northern-born parents. My family's the second black family in Elkhart, Indiana. My father was born in 1928. His father was there before him around the First World War. Very, very deep roots. I brag about the fact there's been 3 NFL players from Elkhart, and they're all my family. I brag about that, you know. So we're all superstars. So I just want to put that out there. But one of the things that really kind of opened my life was one day my dad, who had a 9th grade education and was 6'4", 285 pounds, was a garbage man, a pastor. We had a Sanford and Son business in the backyard. He had a plastering business where he did, he bought old houses and tinkered on them until he got people living. Then he tinkered on them some more. And I remember my dad at 45 already had a disease that was going to kill him. At 53, he had to retire, and at 58, he was dead. And I remember, though, one day, as a garbage man who had moved up to be a sanitation, the foreman, and drove a pickup truck, one day while I was in the front yard, the mayor and the street commissioner came to my house, and they wanted to see my dad. And I remember saying, why would these white men want to see my 9th grade educated daddy? And they wanted to fire Sam Owens, who had worked for the city, and who they found him asleep in his truck. And my dad was fighting for Sam Owens' job. And somehow my father had worked his way into a position in that city without having any notion that they would not fire Sam Owens without my father's permission. And so the mayor and the street commissioner came and asked my dad was okay, and my dad just screamed. Screaming to my dad was about the way I'm talking now. Never heard him raise his voice. And he said no. And I remember the street commissioner was a little boss hog of a guy. He ran outside, smoked a cigarette, and ran back in the house. We got to fire him, and Dad said no. And he said the reason why you can't fire him because he has a job working all night. And runs on his bakery 10 hours, then he comes to work and works 10 hours. So he's working 20 hours a day to take care of his family. You don't fire a man for that. And I remember they left and didn't fire him. I learned 2 things that day. The first thing I learned is our job is stand in the gap for people. And the second thing I didn't really fully understand because I didn't know why those 2 white men would see my daddy. But over a period of time, I began to realize he'd been in that city all his life. That's why it was important that we'd been there all of our lives. And he knew all the black pastors, all the white pastors. There were no Latinos in our city at that point. And he knew everybody in the streets and in church. And I knew he had to build a relational power to be able to do it. And so over the course of my lifetime, when I saw a few years ago when our mayor began to build, the mayor of Indianapolis decided he was going to build a $1.75 billion criminal justice center that was going to add 1,500 new beds, that was going to expand ICE detention, and 40% of people in our local jail at that point had a mental health diagnosis, were going to jail. And they were talking about expanding our capacity to build people. One thing I knew was that we had to stand in the gap with our people, who are also me, because I have a felony also, and also we had to build the capacity to be able to do it. And so we began to work very diligently on a mission that would say it is not right to build places to incarcerate people who have a mental health diagnosis. That's a health crisis. That is not a crisis of people who are doing bad things. And we began to realize that one of the things, I don't know, I guess I've got one more minute, I don't know. And I guess over the course of the time, one thing I began to realize was also that there were lots of people who were around us, who were our people, who were us. And so we had to change the context because everybody was saying, well, we got to speak up for people. And I began to get offended by that, because I'm like, I'm not speaking up for them. I am them. And so what happens if we walk together in unison? So we began to realize that in our city, that 88% of people who vote in midterm elections were white and over 65. And so that means that the imagination of Indianapolis was the imagination of 65-year-old white people. Now, I got no problem with 65-year-old white people, but I don't think I should be living in their imagination. So we created a virtual universe, and we said we're going to talk to people who aren't 65 and white. And we realized that we talked to 164,000 people over the course of a 6 or 5 week period. They were all Black, Latino, single mothers, poor people, white people who just didn't have much but cared about this issue. And they said, we don't want to incarcerate our people who are being thrown away. And so we end up moving forward in a conversation with our mayor, and then he heard the voices of those people, and he heard the voices of everybody in that movement, and then that $1.75 billion, and we talked to 22 out of 29 city councilors in our city, and we explained to them why they shouldn't do this. And not just us, but I'm talking about the people, some of those 164,000 people that were poor and single mothers had conversations and began to talk to one another, and then they shut down that $1.75 billion jail, and it went away. And that's what we're most proud of in our work. And so mental health people that are now that were being thrown away now, they invested $30 million in a mental health facility, and invested training, MCAT training and CIT training for police officers, and created opportunities for policemen to be able to identify people who are in mental health crisis when they see them. And instead of arresting them, the pilot program on the east side of Indianapolis had policemen that have now encountered 250 calls, and they've only arrested 6 people in that cause, identifying people who are not needing to be arrested, but need crisis intervention. And that mental health crisis is being addressed in the city of Indianapolis. So we're happy about that.
Just pick it up from here. Greetings from Chicago. Yesterday in Chicago, Chance the Rapper spoke before City Council. He asked City Council not to spend $95 million on building a police training center, but to spend it on returning mental health facilities and education to the city of Chicago. Yesterday, you might remember former President Barack Obama. He went to jury duty in Chicago yesterday. Those two events happened downtown Chicago. I work in North Lawndale. North Lawndale is 3 miles away from that, but it may as well be on another planet. North Lawndale began as a Czechoslovakian neighborhood. Then it became Jewish, and with the Great Migration in the 1950s and 60s, and racial policies, redlining, and such, it became Black. It had 87,000 people in North Lawndale when it was Jewish. It was 125,000 when it was a Black community. When Dr. King came north to fight for jobs and fight for fair housing, he lived in North Lawndale, right around the corner from our facility. When Dr. King was assassinated in 1968, our community experienced extreme civil unrest. There are now vacant lots strewn all through our community that have existed since 1968. North Lawndale used to be the world headquarters of Sears, Roebuck and Company, of Magic His Carpet, Western Electric, Ryerson Steel. By 1980, all of those businesses were gone. We now struggle with inferior schools, inferior educational outcomes, generational abject poverty, joblessness, and an extreme underground economy. We're right off of one of the major highways that comes through Chicago, 290, the Eisenhower Expressway. People come into North Lawndale all the time. They stop in, they buy drugs, they leave. That's the economy that takes place there. The education of our people in North Lawndale, 1/3 of those between the ages of 20, 70% of those between the ages of 20 and 24 are unemployed, not in school. 1/3 of the people don't have high school diplomas. Because of the loss of all the jobs and all the middle class building in this area, people have but one outlet, and so people sell drugs. People revert to other criminal activities really just to survive. You can talk to young people who now have parents who are in the system, in the criminal justice system as a result, and when they need money, there aren't jobs for them, there aren't ways for them to do that, so they go out and they'll sell drugs. I'll talk to a young person who now has a case. They often have a gun case. Why did you have a gun? To protect myself. Why did you need to protect yourself? Because I was selling drugs. Why were you selling drugs? Because I needed money. Why did you need money? For food, basic things. And it creates this system of incarceration. We are, North Lawndale, you may have heard one of the things that happened in Chicago a couple years ago, almost to the day, was the release of the video of the assassination of Laquan McDonald. Laquan McDonald was killed 3 miles south of our facility. His great-grand-uncle has a church right around the corner, and some of our children went to middle school with him. We are in an area that, because of all these other things, becomes heavily policed. And that policing then ends up with a lot of our children, a lot of our adults being incarcerated. The effect of the incarceration, particularly of these men, ends up with children growing up not knowing who fathers are, with women carrying a heavy burden, with the issues of health, of strokes, hypertension, diabetes, smoking, all of these things becoming true issues for them. When we think about health equity, the average length of life in Lawndale is 72 years old. In most other communities, it's 85. The quality of the life and the length of the life is directly impacted by this whole issue of poverty and incarceration. And by the way, the city council voted 48-1 to spend the money on the police training center.
So I just to get the conversation started, I'm wondering if both of you can talk a little bit more about the specific work that you're doing and what some of the early impacts have been of your work.
Our in Indianapolis with IndyCAN, which is part of the PICO National Network, I work primarily on criminal justice reform, but also on violence reduction. And IU put a study out just earlier, a conversation out earlier this year that the murder rate in Indianapolis that has gone up every year over the past 4 years, it's at such an epidemic level it's at the level that if it was a disease in people's heart, heart disease, it could actually qualify for funding in research. So, I mean, this is a real thing that's killing real people. So our work now has been in those two areas. How do we, first of all, stop people from being killed by ourselves and then by the policemen? And how do people get arrested and not be incarcerated or murdered while they're doing it by state-sanctioned murders? So our goal has been to to create these relationships, and it's kind of an interesting relationship because in order for us to lower incarceration that's happening with mental health and to lower the murder rate, those two things we feel are crises in our cities that are causing people to not live. And so our issue was we had to have relationships that involved tables, that involved social agencies that were city-based and local and steeped in the neighborhoods. So it's comprehensive violence reduction pieces, and then to continue the work on how do we help the mayor finish the process of actually getting these people pointed directly in the mental health facilities that actually save their lives and save them from going to jail. So that's what we're working on specifically.
And who are some of your partners that you're working with?
Yeah, we were forced to work, and we kind of glad to do it IMPD and the police department. Okay, we had to work with Eskenazi hospital systems. We're having to work with the UNRWA neighborhood associations. There are six targeted neighborhood violence prevention projects, tables throughout the city, pointed toward the most highly rated cities in terms of crime. And we're also working with Midtown Mental Health Services. And all those groups are beginning to work together to create, and then we're creating what's basically a neighborhood networks of volunteers that are connected to all those groups who actually follow the most vulnerable people. Because in every city in America, it's about 700 or 800 people that if they could be addressed, the crime rate would drop through the floor just in a matter of, and it wouldn't take 6 years, it would take about 6 days. And so to find those people, identify those people through soft data and hard data, to put actual violence interrupters in the street who actually are connected to the people that are most vulnerable, and to have that data translated into community leaders who then call people in and create opportunities for people to translate their lives into something that's workable for all of us. Yes.
BBF focuses on several areas. We work on employment, education, youth services, family services, health and wellness, community engagement, mentoring. We are working hard, one, to try to keep people from going to prison. We're trying to help empower them and improve their lives. And then we work a lot on reentry. What happens to all those who come back in? North Lawndale is one of the places we have the highest rate of reentry in North Lawndale than any other community in Chicago. So they're going in, they're coming out. We can't do much when they're in, but we try to do what we can to keep them from going, and work as much as we can with them when they come out.
Who have been some of the key partners that you've worked with, and maybe suggesting other partners that you wish were at the table that you'd like to reach out to and involve?
You know, given the work that we do, we are ground zero for disinvestment and neglect. So we find partners every place that we can. There are a number of agencies in our community that are working, and we're working together with them through different collaborations. So we find the Kennedy Forum and the National Association of Mental Illness to try to elevate the issues of mental health and CIT training. We work with the police department in the same vein. We work with Mount Sinai and Advocate Hospitals. There are a number of other social service agencies, the National, the North Lawndale Employment Network, just pretty much everybody we can get. We are working now, there's an organization called Get In Chicago that is really working to try to help do studies and promote things that would reduce violence, that engages young people. We get good funding from them and help to work there. We're working hopefully greater with the MacArthur Foundation and some other places that can help support the work that we can do. One of the things that's interesting, Juard, is that you know, our police chief talks about this strategic subject list and trying to identify these 1,500 people who are creating all the violence in Chicago. I challenge that in that you can take care of those 1,500 people, but we have systems that are keeping people down. We have systems that are working to create these issues, and to the extent that we fix these systems, then we have a much better chance of moving along. So a lot of the work that we do also is to help empower and advocate to move this whole process forward.
I appreciate that, because that's 100% right. I think when I mention those people, you're 100% right. I think we're talking about the people who are most likely to be impacted the most by those systemic, the ones. But our job, we're community organized. We don't even do direct service. So our job is strictly to work in those areas on policies that affect those people that are most likely to be affected. So our job, the people that we work with, are to help groups like your group to connect with those groups. But our job is to organize the diaspora. We have, as a statewide organization, we have just tens and tens of thousands of people that are part of our organization. And you're right, our job is to make sure that systemically policies like this past week when Aaron Bailey was killed, our job was to make sure that if the prosecutor wasn't going to prosecute those people, we advocated that the police chief fire the policeman who shot him. And he just yesterday said that he was going to fire those two men who killed Aaron Bailey in the street. So that's exactly right. So I agree with you 100%.
Yeah, that's important because we have programs, and a lot of places have programs. Programs are progress, but policy is power. Mm-hmm. So to the extent that we can advocate and really help to change the policy and help to impact the laws, then we have a chance of really moving this forward.
Well, thank you both so much, and I'm sorry that we have to move on, but we will have a chance to all talk at the end. Moving on to our second theme, which is focusing really specifically on children and youth and some of the factors that influence the outcomes that we see in kids, and with some of the data and also some of what kind of work is happening on the ground. So maybe starting with the community context with Sam, and then hearing about some of the data from Vesna.
Thank you. Good afternoon, everyone. Greetings from Los Angeles. Go Dodgers. We had a rough Game 7, but we'll be back. I'm with the Magnolia Community Initiative. And I think the initiative officially launched in 2008, but the strategic planning and the thought process behind it really actually started much earlier with the leadership of the Children's Bureau of Southern California, asking the question that, you know, we're an organization that's been around for over 100 years, and we do great work in the community. But how come we aren't able to change conditions for children and families in the neighborhood? And so they brought in partners to have a conversation around this, very much like we did today. And it was really, really incredible and refreshing to be in a room full of like-minded folks that recognize that we do have to reduce silos, and cross-sector partnership is critical in the work that we do. But it's hard. One of the challenges of the initiative is that we live in a very condensed part. LA County has over 10 million people. The Magnolia Community Initiative, or MCI for short, we service a 500-block catchment area, which has over 110,000 individuals. And much like the communities that all of you serve, we are challenged with low educational attainment, poverty, crime, child obesity, lack of green space. So the question really became, how do we address these issues? And we can bring folks to the table and have these conversations, but what is actually going to move that needle? And so first and foremost, MCI, we're an approach to creating a learning community. And that learning community is really about, bringing all the expertise toward child and family well-being. And how do we actually do that? We feel it's critical that there needs to be a recognition that there needs to be a change in behavior within sectors. I think when you bring sectors, there's a culture of doing the work a certain way. And oftentimes we say, well, that's not necessarily my job. That's housing, or that's actually mental health, or that has to do with early childhood. So how do we change that behavior, bringing people together in the same room? The second thing is, how do we know we're succeeding? Do we have a shared data system and of collecting that information? One of the biggest challenges in LA County is that since it's so large, the data that is publicly available, it doesn't really help us to look at the local level and what actually is happening in neighborhoods. So early on, MCI realized that we had to collect our own data. So actually right now, we're in the midst of our canvassing effort. We do this every 2 years, because 500 blocks is too big to go door to door. We identified 22 blocks, which is kind of our focus area. And our team actually goes door to door, and even within those 22 blocks, they're knocking on over 2,500 doors and getting responses from residents around the protective factors and a sense of belonging. And why is that important? because we bring that information back, and we not only work with our partner organizations, but we're working with local residents to make a sustainable change in their neighborhoods. And so that's, I feel like, makes MCI a little bit more unique. Again, it is a learning community, which is tough for some organizations because sometimes they want very clear deliverables. What are we achieving? Are we going to reduce obesity rate? Are we going to reduce crime or gang prevention? But again, it is a learning community where we are sharing, looking at data, and really trying to innovate and create new strategies that's going to be impactful and sustainable.
Greetings from Washington, D.C. and Bethesda, Maryland. I'm Vesna Kutlesic at NIH, and I need to redeem myself first. Kimber, I wasn't in Jordan because Vice President Biden was traveling there, and they canceled my travel because the embassy was worried about security. And President Obama did the same thing to me for Ethiopia. So I missed, the only 2 meetings I missed was because of President Obama and Vice President Biden. But I was actually thinking about what would be most interesting to discuss from an NIH perspective, because NIH is such a large place. And we have 27 institutes, and I'm at the institute, which is focused with the greatest concentration on child health research. However, we're also unique in that the Eunice Kennedy Shriver National Institute of Child Health and Human Development is also focused on learning and helping children realize their developmental potential, and not just children, but people, because the focus is on child development, human development. And I'm actually very excited about that mission, because as I was thinking about the different places in my career that I've worked as a clinician and as a researcher, helping people realize their potential has been the theme in an otherwise kind of interesting CV that looks like it's all over the place sometimes, including New Mexico. Ben and I were exchanging stories. I worked at Laguna and Acoma Indian Reservation. So the common theme in all of that is helping people realize their developmental potential. And as far as research goes, sometimes if we're more practitioners or in the field, research seems something that is somewhere over there and uncomfortable and has statistics and all these kind of more artificial ways of looking at the world. But what I find very valuable in research is systematically observing the world around us and the communities around us and trying to understand what is it about what we do that really has an impact and how to improve what we do so that it gets better over time and we learn from our experiences and improve the techniques in our approach. And then also to share what we've learned with other communities. And we always get into the dilemma, can we transplant something we've learned in one community to another? Sometimes yes, sometimes no. But research helps us really understand what we can adapt to another setting, and then what maybe is unique, and what culturally do we have to take into account to really be more responsive to the community that we're working with, rather than having a cookie cutter approach when we're trying to intervene. So I think that no person can be an expert in everything. And what I found also very valuable, and that we've talked about a little bit, is having a interdisciplinary steering group of some sort or committee that helps brainstorm and helps guide, whatever set of projects we're doing, whether it's research or program implementation, et cetera, and having diverse backgrounds at the table from the very beginning and thinking about evaluation from the very beginning, because it's often an afterthought. We're very eager to help some of these communities we're hearing about this morning that, of course, pull at your heartstrings and you want to get involved, particularly when we're looking at children and their families. However, we really have to, again, step back and approach some of this systematically. The other thing I would say, because I've been more involved in international types of research, global health research in recent years, and with that comes program implementation and policy development. Sometimes in the U.S., we know very well what we're not doing well and what we need to improve on, but really we've come a long way in many ways, and if we travel outside of our country and go to some other countries, we realize that actually we're leaders and the world is looking to us for a lot of what we are trying to work through in our own complicated community that's very rich in its diversity. And so I guess I'd like to remind us as well that there are many things that people have been working on very hard for many years, and we have had progress. It's just sometimes it's slower than we would like, and the world is looking to us. I can also say while I was on a Fulbright and working for UNICEF abroad, people translate the reports that come from the National Academy of Sciences. They translate things that come from the NIH. And no, it doesn't always fit their health system, it doesn't always fit their community, but that's for them the top of what they can really benefit from when they're starting from nothing or with an infrastructure that doesn't resemble anything that we could identify with in our own country, even in our poorest communities. So I just wanted to kind of add that kind of optimistic note, because I know we have some really challenging social, difficulties and communities that are really in need, but the hard work really does pay off, and we've had some progress, I'd say, as well.
That's great. Both of you mentioned learning communities in sort of slightly different contexts, but I'm wondering if you can expand a little bit on how you translate information among, you mentioned cross-sector collaboration, how you translate that information when you're going door to door and you're collecting this information from people. First of all, how you translate it back to them, because they're giving you their information. So how are you then looping back with them with the results? And then also how you connect with your partners around translating that data. And that question can go to both of you.
So I had mentioned earlier about the community survey that we do, where we go door to door, 22 blocks in a focus area. So 3 years ago, and during that effort, one of the things that came up was that we recognized that families, many of them, majority of them that live in our community, weren't reading to their child daily, because one of the questions we ask. And if you have early childhood experts here, that's one of the indicators to successful transition into kindergarten. So a group of providers or partners got together and said, okay, we want to work on this issue. So they implement, an improvement science approach, a PDSA, Plan, Do, Study Act, around this issue. So the first thing they said is, okay, let's actively really promote daily reading with our families, with our parents. So we have partners working in Head Start, preschools that actually did this. And then we want to make sure that, how do we know? So we implemented a survey. So after about 6 months of doing this and actively promoting daily reading with posters and messages and everything, we did a survey and we asked 2 questions. So the first one was, did your child's teacher tell you about the importance of daily reading to your child? 80% over said yes. The second question is, do you read to your child daily? Under 40%. Okay. So I think we all know information itself is not enough. We learned that from tobacco, and someone mentioned earlier about the advocacy of tobacco. So they went back to the drawing board and said, okay, we have to shift. This is something that we learned, let's shift. So one of the partners came up with an idea about, let's make it a routine, like brushing your teeth or putting on your clothes or combing your hair, if you have hair. So that's what they did. So the providers worked with parents about creating a routine. What's a good time for you to read to your child? Where in your place can you read to your child? Do you have books? And some of our community members are challenged with literacy. So fine, picture books. It doesn't have to have words. But it's really about just reading to your child. And so we started testing this. And then we started seeing slowly that percentage of parents reading going up. But we needed to collect data. How do we get this information from them? So the first thing that they did was they sent home a weekly log and then please check if you're reading daily. But those weekly logs don't get turned in, right? So we're saying, okay, that's too much. Let's just really, really simplify this. So most early childhood programs, in fact, all of them, when you drop off your child, you have to sign your child in and then sign out your child. So they decided to add a column to that sign-in sheet that says, did you read to your child last night? Check. So we have our reading trackers. So now we have the data. So today, about 3 years later, we're at close to 80% of over 500 families reading to their child daily. Now, that's great in a programmatic sense, but are we truly moving and changing neighborhood conditions? And this is when that local data that I spoke to you about becomes extremely important. And I have my good friend here, Efren Aguilar, who works at the UCLA Center for Healthier Children, Families, and Communities. And they're leading a national effort to implement implement a neighborhood profile assessment tool called the Early Development Index. I'm not sure how many of you are familiar with this particular tool. But what's unique about it is that you're asking kindergarten teachers to assess the children in his or her classroom. But that information then gets back to UCLA that geocodes it to the neighborhood that the child comes from. So it's a neighborhood profile, not an individual child profile. So now, and it's by census tracts. So now we know where our families that are participating in that family routines reading program are coming from. And we can use data that's created by the EDI and UCLA to see if we're actually moving that school readiness to kindergarten needle. So those are some specific things that we're doing that, again, really promotes innovation. But the bigger part is that now we're ready to bring on more partners to be able to adopt this. And we're not only looking at early childhood partners, we're looking at every partners that has worked with families that has a child 0 to 5 in their home.
I was thinking about the different levels of learning that need to happen for research to be implemented. And some of it was similar to what Sam is describing when you're in a research project, particularly if you're in a community program implementation of some sort and you're part of a research network. There are community outreach teams and that are specializing in learning how to reach out to families to get them involved in the research, and then also people who are part of a communications team that are then trying to disseminate what you're learning from the research to keep the motivation and keep the participation on that level. And then we have an exchange with our scientific community and the researchers themselves about what are the needs in their fields, how do we need to expand what our research priorities are, and so we seek that input. And then one thing I didn't know before I moved to Washington was how involved Congress is in overseeing everything we do at NIH. And so we have very regular, probably weekly hearings about different health issues, different social issues that also impact our institute. And we have a lot of constituencies that go to Congress and either say we're doing a good job or we're not, and we hear about it, that we have to answer for. But it actually does keep us on our toes, and much of the time it's very welcome input, unless, we tend to have the controversial grants that are those that folks in this room are champions for. So if someone's looking at why are we using taxpayer money, it's usually in our institute that we're having to answer for it. So anyway, I think there are different levels of learning and information, and that is a very important part of what all we're trying to accomplish together, particularly since sometimes research seems like it's a one-way type of enterprise, or it's a top-down kind of enterprise. It should really never be that. It should be more inclusive, and we should always remember who it is we're trying to help and have them at the table, as was nicely illustrated with the committee that had representation from all the different groups people were trying to be responsive to, including children. And that was one thing with UNICEF when I worked with them, that having a child on every committee was very important. And they had fabulous ideas well beyond their years. And they were often more strict with themselves than we would ever be. If we asked them if there was some problem, they would often have a much more, tougher discipline than we would ever give them. So I think that they're really refreshing to have at the table when we're thinking about child issues in their families.
That's great. And again, I'm sorry we're going to have to move on to the next but thank you, Vesna and Sam. So we heard already, not directly, but via video from Aaron Bartley and his project, Push Buffalo. So I think we'll probably go to hear from our other person in that pair, Patrick Sharkey from NYU, and hear a little introduction about his work.
Hi, everyone. Can you hear me okay?
Yes.
Okay, good. I'm sorry I'm not there in person, but it's been really fun to listen in. The activities, when I hear Reverend Barnes talking, this is what I've been studying, and your kind of description of what's going on is so consistent with what I find in my research. It's really fun to hear about. So We've had I want to talk in particular about violence, and the reason I want to talk about violence is because there's just everything I've done, all the empirical stuff that I've done over the past 10 years or so has kind of tried to understand why growing up in a disadvantaged or low income or poor neighborhood might affect kids so drastically, and all the evidence that I've seen points me toward violence as the crucial factor. There are other factors, certainly, but this strikes me, communities can't survive if they are unsafe. Schools don't function if they are unsafe. But we've had this tremendous change over the past 25 years. In U.S. cities, the level of violence has been cut in half. Violence is still way too prevalent in many neighborhoods and cities, and it's rising, as was mentioned. In Chicago, it rose drastically the past couple of years, Indianapolis as well. But I want to emphasize that this long-term drop in violence that we've seen really gives us an opportunity. And what it has shown is how children's lives are changed when violence falls. So we can see, and this is, I have a book coming out in January that documents this. We can see children doing better in school in the cities that have become safer. We see life expectancy improve. We see the chances that children will move out of poverty increase. We see economic segregation, the degree to which the poor live apart from the rich, that has fallen in places where crime has fallen. So, city life and neighborhood life really improves in a very tangible way when violence falls. So then the next question is, well, why did violence fall? How do we explain this? And this is where I think the work that you've been talking about on this panel is absolutely crucial, because it's left out of policy debates and academic debates about this question. We have focused, all of the national work on this question, why did violence fall, has focused on incarceration, on the police, and then on other theories, all of which have some merit, focus on lead exposure, things like that. These factors matter, but what has been left out of these debates is the work that is being discussed in this panel, and it's really inspiring to hear about. It doesn't come up in these national debates. People focus on forces or programs that are kind of external to the communities that have been hit hardest by the problem of violence. So I spend a lot of time talking to community leaders and hear these stories, and it strikes me that it's a very different account of why neighborhoods become safe. When housing is built, when an organization works with people coming out of prison, or an organization has violence interrupters, this is what creates stability in a neighborhood. And so I just wanted to briefly mention a study that I did that just came out that looks at this at a national level. And the reason I'm looking at it at a national level is because so much of the work that documents this is from case studies. But it's hard to see if you're not from the particular neighborhood. If you don't see what's going on, it's hard to really buy into the idea that the work that you're doing is transforming neighborhoods. So this was a national study I did that looked at across the country in the largest cities, what happens when new organizations emerge to build stronger neighborhoods, to confront violence, and is there actually a causal effect? And this study just came out, and the evidence, I think, I was astounded at how strong the evidence was. So the reasons I bring this up and the reasons that I hope it's useful are twofold. The first is that it highlights the impact that everyone in that room, on that panel, is having on cities. It may be clear to people on the ground what you're doing, but it's harder for those outside the neighborhood to really understand. And then secondly, it gives us a different perspective on how to reduce violence and how to build stronger communities moving forward. And we've had this model in place for several decades in a lot of cities that has really relied heavily, if not exclusively, on the police and the prison system to address a whole range of social problems and challenges that comes with concentrated urban poverty. And so what I'm hoping is that this evidence, if it's worth anything, it's giving us a different model moving forward. It's kind of shining a light on the work that you're doing, and it's saying, actually, we have very strong causal evidence that this is transforming neighborhoods. So it's giving us a different set of actors. If we want to make investments in neighborhoods, I think the investments in those local community organizations that look out over the neighborhoods are the best investments we can make.
Thank you. And I do want to echo what Patrick just said, in that everyone on this panel is bringing up issues that are not talked about as much in the public debate as they really should be. And certainly even from my perspective in planning, we don't talk about these issues nearly as much as we should either. Probably the closest we come is talking about housing quality. And I'm wondering if first, Aaron, you can talk a little bit more about some of the physical characteristics, and then we'll loop back to Patrick. But some of the physical characteristics that have an impact on these social bonds that then have, you know, a wave effect on so many aspects of community living.
Sure, I did have a few slides. I don't know if we're going to still go with them, but yeah, I guess in answering that, I really want to bring it back to where we started the panel with community power, base building, community movement building. And also honor the folks who brought that into the space today. We've heard a lot about Black power struggles, trans liberation struggles, intersectionality, and to me, that's where the culture of health begins in communities. It's an analysis of power differential, of extraction, exploitation. And I think it's in some ways most clearly identified with the fact that we know what makes healthy housing. It's not a mystery. We know Luz Velez, in the movie, she knew what would make her house healthier. It was the system not providing the resources needed to get that work done that was blocking her health progress. And for us, it comes back to what Juard said about relational power. It's about getting together, building a base, expressing what is known at the community level, and fighting for that change. And this slide demonstrates one way we do that. I don't know if the slides are up or not. We break it down to the neighborhood level and block by block, parcel by parcel, challenge the community to re-envision and reimagine what it wants its future to be through meetings like this. And we formalize that through our structure, taking places like Dudley Street Neighborhood Initiative as a great example. And we've moved the plan forward that pretty much comprehensively for a 30-block area has enabled the community to get control of its land, of its property, and therefore of its future. And I want to express, had a conversation at lunch around how critical the gentrification process is to creating an unhealthy culture in cities currently, meaning that displacement, moving people around, breaking cultural bonds, breaking bonds of connection to services, and is really a fundamental underlying trend, in my view, of unhealthy cities as they're currently structured. And so for us, gaining community control of land, community process for planning that land is essential to building that culture of health. So go to the next slide. That connects to something else we heard about earlier from various panelists, which is just land itself. What is our relationship to our land? We could either see land as something that's external to community, that developers control, that they build fancy houses on, or we could see it as a site of health and culture building and civic pride, and that's what we've tried to do with a bunch of the land we hold. This is 27 families farming on a plot on 14th Street. It's a food justice embedded into that lot. There's just language exchange, cultural exchange embedded into what happens in this space. And there's also the larger question of the future of the city, the right to the city that's cropping up. You know, obviously we're in the heart of it in D.C., of who has the right to D.C., who has the right to the west side of Buffalo. And again, for us, that all goes back to, are we mobilizing our folks, our base, around a future that involves them and that expresses their vision of the future. I also want to highlight in that transition to healthier places in the food, energy, water systems in communities, there is an economy embedded in that. And we all know that a lot of power is embedded in the economy. And so for us, it's also a question of jobs, social enterprise in the transition. So repairing our land, repairing our housing, getting the lead, mold, asbestos out of our housing, managing our water and energy at the neighborhood level, localism, is also about creating jobs and creating the constituency to move those sectors forward in a way that's as community controlled and democratic as possible. I could just have one or two more slides. That, you know, in our neighborhood, 19th century neighborhood, that is really well illustrated just in our housing stock. Every single house in our neighborhood is toxic. It has lead, it has most of them have asbestos, many of them have mold. So again, it's not a mystery. What do we need to do to revive our economy? What do we need to do to make our people healthier? It's right in front of us. We've got to fix our housing stock. The question is, can we get the resources, challenge the folks who have the resources to make that work happen? This is a before picture. That's an after picture. And beyond the normal weatherization, putting insulation in the walls, and beyond the idea of incorporating our community members into doing that work, there's also the opportunity to lead, leading with solar, leading with community shared solar, democratic cooperative forms of re-envisioning our energy systems, along with the grand trend towards gentrification and moving capital back into cities. There's another grand trend in American capitalism right now, which is the deconstruction of utilities and the old way that we produced energy, and the rise of solar energy. And the question, again, there is who's going to lead? Is it going to be the corporations? Is it going to be the monopolies that have done this work for a long time? Or are communities going to have a stake in that process? So for us, that's a question of a culture of health as well. I think I just have one more slide. Yeah, and then we've created, or not created, we've adopted a frame that's very old that goes back to indigenous philosophy and culture around land, relationship to land, and transitioning from deindustrialization, the conditions that we heard about in Chicago, factories closed, there's no work, people on the corner, to what we hope comes next, which is a community-controlled economy, a localist economy. And not a localism that's about hoarding, but that's really about translocalism, thinking about how our local economy of food system repair, energy system repair, housing repair relates to a broader national and international movement for something better. So I'll leave it there.
Thank you. So you're a local organization, and you're organizing these this movement that you just described. And Patrick was talking about the importance of local organizations as community supports. And I'm wondering, Patrick, if you could just briefly talk a little bit more about the role and the place of such local organizations, whether it be to partner with government or to be the conveners for local coalitions.
Yeah, it's a crucial role. And, we've kind of known this for a while, but the sheer presence of this kind of, Aaron's organization creates stability in the community. When housing is built, it gives someone a place to live, but it also sends a signal that the community is overseen by people who care about it, that it's not going to be abandoned, that it's not left on its own, that public spaces will be taken care of in that community, and that there are people and organizations looking out over that space, looking after the residents in that community. So the role that local organizations play is to link people together, to link people with core institutions of their community, and to ensure that public spaces are not abandoned. And that's been a pattern, over the last several decades. It's not just about poverty; it's about abandoning communities. What happens when a community is abandoned? And what we now know is that when a community is abandoned by the state, by the federal government, when it doesn't have the local resources to fund schools, high-functioning schools, to keep schools safe, okay, to just maintain parks and public spaces, to have decent housing for the residents. When a community is left on its own, that's when it becomes a space that is ripe for violence. That's when it becomes a space where the community, where people no longer come together and the community falls apart. So I think the work that you're all doing, but whether it's related to housing, violence, reentry, whatever it is, it's creating the bonds that form community, and that's crucial.
Patrick was with us in the room. There he is. So actually, I have one more question for both of you, and actually we can think about this when we come together in just a couple of minutes as a group and talk. But one of the most critical elements here is community trust, and I think all of you kind of touched upon that in different ways. Community members, residents not having trust in the systems that are supposed to support them and help help them lead healthy and productive lives. So I'm wondering if you can talk a little bit about how your work, either from the research perspective or actual practical perspective, is helping to build community trust, and if you've seen any results in that. And increasing civic participation so that people can have more leadership in determining what their environments are like, what their communities are like.
Sure. Yeah. I mean, I think it's important to recognize there are a lot of reasons that people are not trusted outsiders, especially in community organizations and well-funded groups. There's a history of not doing well by neighborhoods, and so taking that history and knowing that history, I mean, for us, it really goes back to leadership development. Control, governance of the organization. Our organization is governed by 80% of our board members live in the community. They're living in poverty. And then leadership development so that the organization becomes a community. We had Jen McCosey, who is in the film and sitting right next to me here, has been in the community from birth, is a leader in the community. She's now our elected official representing us in the school board on the west side of Buffalo. And that's, for us, leadership development. It's everyone has their own path. Providing the tools to take the next step is part of what community organizing is based on.
Patrick, do you have any thoughts on that?
No, I think that's right. I mean, I think we know that the pillars of a strong community are high-functioning institutions, strong community organizations, and then residents who are willing to come together and kind of come together and deal with common problems together, common challenges together. And so the key question there is, why doesn't that happen all the time? And it's not a mystery. You know, people need resources to come together. People need jobs to give them a strong incentive to come together. And you know, again, when communities are left on their own, when they are abandoned, when they are not given the basic resources that are taken for granted in most communities across the country, when their institutions don't work well, then community life fades away, and it's much less likely that people will come together, that they will trust each other, that they will be willing to work together. So I think Aaron's exactly right, that you have to be aware of that history. You have to be acknowledged how people have been treated, how communities have been treated over time, and then develop a new model to bring people together and bring them together with institutions and local organizations.
Thanks. And before we open it up to the audience, I'm wondering if anyone else on the panel wants to just briefly touch upon the topic of trust and civic participation.
Well, briefly, we're a faith-based organizing entity, and part of our issue is that we understood that we're multicultural, multi-faith, and all of those types of things, and we know that we've been losing elections across the nation based on sort of a white Christian nationalism, and so we're trying to work on how do we develop something that you can have a Catholic, a Unitarian, a Black Baptist, Pentecostal in the room, and have a strategic conversation sort of steeped in a secular religion, steeped in values, and so that we can really find what do we touch on one another. So our work is just four factors on how do we encounter one another through conversations, then how do we disrupt the thinking of the group in the way that we operate, and then to reimagine how we can operate, and that only happens through people just continuously. So we constantly have, with the people most affected and people who want to be allies in that moment, and people who want to go past allies and just be holding hands, how are we talking to one another and creating rooms for conversation, and then of course acting together, because you're not gonna love anybody. I don't think you can love anybody like you can love somebody once you've been in a fight with them.
Yeah, I think you know, when you talk about building the trust with the community, I think it's about investment. And I think we ask ourselves, you know, when are you invested? You're invested when you feel like your opinion counts. You're invested when you feel like you can make a change. And the community that we serve in Los Angeles with MCI, they're predominantly an immigrant monolingual community. So oftentimes their voices are not heard. So we're very intentional about how we engage our residents and resident leaderships. And our goal really is to prepare them, coach them, support them, where they can actually be in positions of leadership. And the city of Los Angeles do offer opportunities. They have something called neighborhood councils. There's over 100 in the city of LA. And each neighborhood council was funded at a certain level. And they use that funding to improve their neighborhoods and conditions in their neighborhoods. But who sits on these boards is mostly business owners that don't necessarily live in the community. So our task at hand is really to get our residents comfortable, to be able to run for these seats and these boards where they can actually make decisions that could bring about tangible change in their neighborhoods.
And I just wanted to add, I mentioned Laquan McDonald earlier, and when you see situations where those who are entrusted to protect you are those who harm you, it destroys all trust, and that even went further when it was covered up for 13 months. So all the institutions that were supposed to protect this young man, this young kid, failed, and trust is destroyed at that point. So what we're trying to do in all these ways is, one, I think back to the civil rights movement when they walked around with a sign saying, "I am a man," is to really try and rehumanize the people in our community to ensure that those who are empowered recognize that these are people and these people need things and these people have voices. It's also with the people who are there, and one of the interesting things is how voting has been changed. Citizens United and everything else creates this different scenario where it doesn't feel like each person's vote counts. And we have to go back and make sure that the power is with the people and the votes count, and we can do things in that way to really change the systems.
So I think we have time for a couple of questions from the audience and from folks in the room. So would love to hear what you're all thinking.
An incredible panel. Making it real is what comes to me as you're talking today. What also occurred to me is that we've focused the discussion primarily on urban settings. And I'm just wondering your thoughts about what do you think is happening in rural communities as it relates to the issues that you have been discussing thus far. And it's okay if you say I don't live in them and I don't know, but I'm just wondering.
So, MCI, we're also part of a national collaborative called the Population Change Learning Community, and includes 10 other place-based initiatives similar to MCI. And we have folks from Tulsa, Oklahoma. We have folks from Indian reservations in South Dakota. And so I think some of the issues and challenges may be different, but I think the core values in doing the work about engaging residents, and I think many of the panelists spoke about power. I think you have to translate and operationalize power. What does that really, really mean? Does it mean changing your bylaws? And I think someone earlier mentioned that they have seats for youth and adults and seniors. And I think those are the conversations that we're having. Even though our communities may be different, I think those challenges and the core values and about doing the work are very similar.
I think part of our work, I think part of our work has been in the cities, but we also going statewide. And so we think that the right did a really good job in the last election on tapping into white identity, but we think that there's a way to have that conversation where we found that people in the rural areas did care, and people aren't necessarily in huge numbers locked in one place or another. People have diverse ideas within themselves and they're intersectional. And so we're tapping into that very well and having those conversations where we're finding what identity really looks like for people and who's been isolated and how that isolation has affected them and how that can move to a conversation where we can talk together.
Do the social problems, do you think they're in rural communities, the social issues that...
People getting high everywhere, you know? Yeah.
We use a lot of terms and tools like community engagement. We talk about the power of residency, of being a resident of a location or community. And I live in Los Angeles, and Los Angeles has a horrible homelessness problem. The housing is really expensive. Many of these homeless individuals are veterans who've sacrificed a lot to provide us the securities that we have. At what point are we going to start talking about universal housing or something bigger than what we're doing now?
I'll say, I was in a similar discussion yesterday in Chicago on health equity, and one of the hospitals talked about housing and what it actually costs for homelessness in the healthcare scenario. So the fact is, in that case, and with this community organization, they're looking to put people into SROs to get them the services that they need, recognizing that the cost, the burden on the system, the burden on all of us, on taxpayers, is halved by having people not live on the street, but be in these places. So just as these forums are happening, we need, I'm glad you raised that issue, because we do need to recognize that and recognize the greater burden that homelessness has on our entire society.
I'm not an expert in housing, but I recently saw this video, and it was about how Singapore addressed the issue of affordable housing, where here we have even permanent housing is rental, but their whole thing, it was a path to ownership. That was their approach to housing, that they felt that to truly have investment of that space that you're living in, there has to be ownership. And with MCI in our catchment area, 95% of our families rent. They rent. And so, again, I don't even know what that would look like here, but, I just thought that was a really interesting look and how to really look at this issue of housing.
Yeah, just a quick, let's start talking about it now. I think it's a great question. We know what's creating homelessness at an epidemic level. It is gentrification. It's the desire of the real estate community to control every urban space and to extract as much wealth from each space as it can, and it's about creating a movement to counter that. We also know there is a tradition of public housing in this country. We know that it got defunded and deconstructed systematically by people in power, and we got to get back to fighting back.
First of all, fabulous work by all of you. I was totally blown away and impressed. My question is, when you're all working in unique ways within your communities, but have you come across sort of common either data points that are needed or types of data, or how do you come to communities and say it's much more valuable to invest in the ways that you all are trying to invest, sort of from the positive perspective rather than from the punitive or the more negative perspective? Right, so rather than letting houses, degrade and whatnot, rather than building jails, rather than not providing reading programs, right? That's sort of the more negative or punitive measure, and it seems like across the country, just with the recent votes, there's positives and negatives around what are we spending our money on. Have you come across common talking points about this is what I need to show my community members that it's worth this investment?
Our work is, as organizers, is not steeped so much in regimes, but in narratives. So our work is to do research and then to place and then to search out best practices, around the country. And so whenever we introduce something in Indianapolis or any one of our cities that we're involved in, it's always, we never introduce anything without, first of all, having built consensus, because everything is about conversations, right? Hundreds and hundreds and hundreds and hundreds and thousands of conversations. And then to research actions which bring people, thinking partners into the game and change the narrative. So, because I think that one of the issues we have on policy change is that if there's been no narrative conversation that has changed, like if people still think that the biggest problem is that it's bad people who create problems, then nobody's going to understand that this is systemic issues that's really killing us. And so you'll have people getting up talking about bad people and not about bad stuff. And so it's all about the conversation. And once the narrative has changed, but that has to happen through conversations with people who are in power and putting people who are not in power in the rooms with people who are in power and having the people who are not in power have enough information to actually inform people who are in power. Because city councilors don't know, but we do.
I'd say we, as a community-based organization, one of the things that I have to do is to raise money to keep the lights on. And data is a good thing for a lot of reasons, but a lot of foundations are using the data to support specific programs and not support the work that I do, because I'm in an administrative role. And so to the extent that we can move to a place where we can get more dollars so that we can help to keep our lights on and do more advocacy so that people can see North Lawndale exist in Indianapolis, in Baltimore, in DC, in LA, and every place else, then we will see the connection of all of those things. It is where I look to push more advocacy as we're doing more direct service and dealing directly with individuals, but seeing that each person represents a much broader lineage of what the issues are and trying to push those issues on a broader plane so that we do, in fact, impact systems beyond just impacting individuals. But it has to be a releasing and the recognition that all the dollars that go in can't go only to specific programs, but they have to support the organizations which are doing the work and helping to identify what these issues are in a broader way.
I think for MCI, it always starts with data with us. Early on, there was a shared measurement system that the partners kind of agreed upon. So like the community survey or results of the early development index, we're using that information to create new approaches and strategies. And really, I think it's been a little bit of a paradigm shift for our partner, because oftentimes, coming from a program background myself, evaluation is something you may look at it quarterly. You have an evaluator that's going to tell you if you're going to meet your benchmarks. But what we try to do is really on a monthly basis, because when our work groups happen, we're constantly using the data to inform. Because our approach is that, we want to make sure that changes are leading to improvement. So that's really our approach. Changes are leading to improvement. And data is that big part of that conversation.
And with that, we will be concluding the session, running out of time. But thank you so much. I think everyone spoke for themselves in the showing all of the different roles and aspects that are needed to make change, especially at the local level, coming down to these local organizations and local advocacy. So please join me in thanking our panel.